Andrew Furey is the Premier of Newfoundland and Labrador. Hi, Premier Furey. Good to see you and welcome to Ottawa.
Hi, Vassy. How are you?
I'm good, thank you. I appreciate you making the time. Look, I've been speaking to some sources in Ontario's government. They have a pretty clear sense of what will be on the table for that province from the federal government. I just listened to Manitoba's Premier Heather Stephenson said she hasn't seen any details whatsoever where a proposal is concerned. Where do you fit into that spectrum? Do you have a pretty clear sense of what's on the table for Newfoundland and Labrador from the federal government?
Well, I think I know as much as any Premier knows, and perhaps as much as the general public has been aware, and that there appears to be evolving a conceptual framework of an increase in the CHT with a quantum of money set aside for negotiations with respect to bilateral agreements amongst provinces. For us in Newfoundland and Labrador, I've been very clear about our shared priorities, which I think are very aligned with the federal government's shared priorities and arguably with all of Canada's priorities with respect to advancing a modernized healthcare system, whether that's through primary care, advancing long-term care, mental health and addictions, surgical wait times, or technology within the medical practice. Those are all shared priorities that I have and that are important for Newfoundland and Labrador, and I'm hopeful that they're the ones that the federal government shares as well.
And I certainly do have some questions on those priorities in a moment, but just on the quantum of money, as you phrased it, I was reading an interview with you last summer where you said that in a meeting like the one that's going to happen tomorrow, money doesn't necessarily have to be the focus of the conversation. Have you changed your mind?
No, I mean, I've always said that money is important, but I've heard in the rhetoric that's been in the public sphere that just throwing money at it is not going to change it. And that's absolutely right. Just shoveling more money into a broken healthcare system isn't right. But we have a generational opportunity in front of us here to use new money to modernize the healthcare system. And for Newfoundland and Labrador, we've already put together a plan, involved all stakeholders from all political stripes, to look at how to modernize a healthcare system that is sustainable well into the future. Right now, Canada is stuck with a healthcare system that was designed in the 1960s. And for Newfoundland and Labrador, just as an example, back then, there was 6 children for every senior. Today in Newfoundland and Labrador, there's 2 seniors for every child. That's a massive difference in demographics, and one that definitely impacts the delivery of healthcare and, frankly, the cost of healthcare. So we need to modernize it. We need to make sure that it's sustainable well into the future. And sure, money is an important part of it, but it can't be the only part of this discussion.
Yeah, and I think everyone I've spoken to, all the premiers I've interviewed, agree that that is true, that obviously not just money will do the trick, but that there is a sum of money that is needed from the federal government in order to, as you put it, kind of implement the changes that premiers are hoping to make. When you think about that sum of money, do you expect the federal government comes to the table prepared to match the ask collectively of premiers of $28 billion extra a year, or are you prepared for something less?
Well, let's see what they come to the table with. Certainly.
But what are you prepared for?
Whenever negotiations start, well, let's see what they come with. I'm not going to bias the discussion or predispose what they're going to come to the table with. I'm quite confident that the very fact that we're here, Vassy, the very fact that the Prime Minister has convened this meeting that we've been asking as premiers for almost 2 years now, is an important step, a gesture of goodwill that we're all here together, working collaboratively for the advancement of a sustainable healthcare system, a modern healthcare system that Canadians once again can be proud of. So I'm not going to predispose any discussions around the actual quantum until I see it. But I'm confident that we're here, that there is a level of shared priorities that can meet the needs of Canadians today and into the future.
Speaking of that sharing, Premier, the Globe and Mail is reporting today that the federal government will expect, alongside the transfer of more money, that provinces don't decrease their share, really, of provincial health care money, so that it doesn't go to other program spending. Can you agree to those terms?
Incremental increases in healthcare spending, certainly I can agree to that. In Newfoundland and Labrador, we are we're doing above and beyond, because we need to invest the money incrementally in addition to what we've already invested to modernize the system. Now, will there be savings long term? Perhaps, with the utilization of modern technology and expanding scope of practice and some other inventive, creative, modern solutions. But certainly incremental proposition is something that we'd be certainly willing to entertain. No doubt about it.
Sorry, can I ask in layman's terms, when you say incremental, is that different than saying, okay, I won't decrease the amount of money I'm investing in healthcare so long as I get this money from the federal government? Like, can you explain that in layman's terms?
Yeah, sure. So it'll be in addition to what we're already spending in terms of our provincial spend right now. The additional money provided by the federal government currently will be added to what it'll be additive, I guess, to what we're currently spending.
And that's a pledge you feel you can make for the next 10 years?
Absolutely. It's going to take us, and we have a 10-year health accord in Newfoundland and Labrador, it's going to take us an investment certainly in the first 5 years upfront to modernize the system, whether it's utilizing technology, eliminating red tape in the practice of medicine, reducing surgical wait lists by increasing capacity, recruitment and retention of healthcare professionals, including those hardworking nurses on the front lines. All of that is going to take some money up front to get to a sustainable place. We're in crisis right now. We need to mitigate that, get to a sustainable place, and then look to the future. I'm confident that given the plan that we have, the additive nature, the incremental nature of any increased expenditure will be one that we can allocate responsibly to achieve those goals in Newfoundland and Labrador.
Before I let you go, Premier, I was reading a letter from the opposition in your province to you after the Doug Ford announcement in Ontario, where the Premier in this province pledged to clear the surgical backlog through the use of private for-profit clinics. And I wanted to ask you whether, A, you are thinking about doing something similar, because there are big surgical wait lists in your province as well, and B, whether you think the Prime Minister should tie healthcare money to that concept.
Yeah, so first of all, I'll start with the latter. I'm not going to discuss what the operations and authority of operating a healthcare system rightfully belongs with individual premiers. In our jurisdiction, we are looking at utilizing public spaces more efficiently, more effectively. For example, we're utilizing some of our rural hospitals to increase capacity with respect to joint replacement volumes. Ones that are being slightly underutilized with respect to their OR capacity. So we're taking surgeons and anesthesiologists and patients even from the urban center and bringing them to rural centers and then transferring them back. I do think that there's an opportunity, and I can tell you as a surgeon, I've been sat in the OR lounge frustrated with the inefficiencies. There's an ability, and we should be looking at it, how to make the system more effective and more efficient. But I do think more aligned with Dr. Robert Bell in terms of his approach in ensuring that this is a not-for-profit driven entity. So effective, efficient, outside what people would traditionally imagine with respect to a hospital in terms of bricks and mortar, surgical capacity outside those walls. But I do believe that should be in a nonprofit entity.
So just to ask you bluntly, have you ruled out, as Premier of Newfoundland and Labrador, the use of private for-profit clinics to address any kind of surgical backlog?
Well, right now across the country, some of those exist currently, whether it's in cataracts or other delivery
but have you ruled out expanding
surgical services. Right now, in Newfoundland and Labrador, we're focused on not-for-profit or public-funded entities.
Okay, Premier, I'll leave it there. Thanks very much.